When we are empowered as human beings, and that comes through our cells, we are conscious creators of our lives. And that's how we change the status quo. We are empowered, our minds can work miracles, and it all starts with the cells in our body.
This is where it all begins, so say goodbye to all your fears, all your doubts. This is where they die. This is where we come to win, we come to fly. This is where we make our dreams come to life. Welcome to Innovation City.
Welcome to Innovation City, a podcast featuring the innovators, disruptors, and creators who are making things happen. My name is Michael T. Johnson, and I'm here with my co-host, Tyler Kelly. And tonight we're at Venture Cafe Miami. If you're not familiar with Venture Cafe, it is the largest gathering of innovators, entrepreneurs, disruptors anywhere in the world. So on a Thursday evening across the globe, there are people meeting in Venture Cafe cities. So I suggest you check it out. Now, tonight we have Alina Ruta with us. Alina, thanks for being on the show.
Thank you so much for having me.
So Alina is a strong, conscious, clear, creative, and intentional solutions architect of disruptive technologies, specifically in cell growth technology. And we're super excited to talk about you and your company, Cellvana Biotechnology, tonight. So welcome to the show.
Thank you so much. Thank you for having me, Tyler. I appreciate it. Thank you, Michael.
Yeah. So first of all, let's start with Cellvana. So what is Cellvana and where did that come from?
Yes, Cellvana stands for cells in nirvana, or happy cells, because we do grow happy, healthy cells, just like in the human body. Cells are the basis of everything in medical research and medical discovery, and finding cures for cancers, for debilitating diseases. I'm sure everybody by now has heard of stem cell therapies and how they are revolutionizing medicine and saving people's lives. It's really my mission. I feel like I've been put up to this, and my purpose is to assist human beings live the best life that they can. And I'm saying this from a very personal place, because my mother died at the young age of 54 while I was finishing my PhD at the University of Florida in Gainesville. And she really died with the music still in her, unnecessarily from liver cancer, specifically from toxicity in a clinical trial from a drug that was developed with cells that are normally grown with chemicals. So fast forward 18 years, this technology that I actually licensed and we have a patent on kind of found me. And I recognize it because I have worked in growing cells and developing other medical technologies that involve cells when I was in researchers at the university and also in the industry. So I saw the value of it. I saw the market gap and the huge costs that are necessary to grow cells. And the biggest problem is that nobody on the market right now can grow cells just like in the human body without chemicals. We can at Cellvana. And really, I feel that the technology that we have, it's a very simple, very elegant technology. I call it the iPhone of cell culture, because it really stands to disrupt medicine. So that's really how Cellvana came about, and I'm just really on a mission to raise capital and take our technology to market.
Wow. So I didn't know that you could grow cells, like artificially or not.
Yes, you can.
So for the layman in me, like, tell me, like, how that's even possible.
Well, you remember from high school, or basically when you were in school, you remember cell biology, looking under a microscope and seeing cells, and maybe you remember petri dishes. Well, the way they currently grow cells, they've done this for decades. They grow them in these petri dishes, and they put a layer of some nutrient there. And cells are just like us. They like to form tribes and colonies and conglomerate and socialize and attach to each other. So they're very social. I mean, we're made up of trillions of cells, so it's no surprise that our inherent preferences as human beings are those of our cells as well. So we grow the cells in petri dishes. We have grown them, not we at Cellvana, but the medical community and researchers have grown them for decades in petri dishes with nutrients. But then when they're ready to be used, they have to detach them from those petri dishes. Well, there are two methods by which they have been doing that. They either do it chemically or they do it mechanically. So chemically, the cells are like little furry balls. So they have these little legs on the surface. Those are what they're called proteins. So they like to attach to the surface and to each other with these proteins, with these legs. So how do you detach them from the petri dish? You actually chop off their legs. And you either chop them off mechanically with a wand, so you scrape the bottom of the petri dish, or you soak them in damaging chemicals. They're called enzymatic reagents because they dissolve those protein bonds to the surface. So then you have these cells floating about in the petri dish and they're ready to be used. And pharmaceutical researchers use those cells, say pancreatic cancer cells, right? They grow them in these petri dishes and they detach them and they use them. But when they use them, the problem with the chemical method of detaching the cells is that you kill about 70 to 75% of the cells you just grow. So I don't know about you, but to me it makes no sense. Why would you spend time, money, and all kinds of tools to grow the cells and then you kill 70 to 75% of the cells you've grown, and the remaining 25% are maimed because they're missing this essential communication tools, which are their proteins. So when they're developing a therapeutic, a drug against pancreatic cancer, and they use this pancreatic cancer cells that came from somebody's tumor, that pancreatic cancer cell that they just used to develop a drug that works on that cell is not like in the patient's body, in their tumor. So when they give that drug to the patient, it creates a lot of toxicity and it ends up killing people. That's what happened to my mom. She was killed by toxicity in a clinical trial. And for me, this is really personal because she didn't need to lose her life. I have seen so much suffering in hospitals. And it's not only the patients, it's their families, it's their kids, it's everybody that is suffering, and that's unnecessary. So how about if we shift the paradigm? Instead of thinking, let's detach these cells mechanically or chemically, and we just invent a better mousetrap. That's what everybody else, our supposed competition, is doing. They're just developing incrementally better mousetrap that are not killing as many of the cells, that are getting higher yields, and maybe retaining more of the surface proteins. Well, what we do at Cellvana, we're basically shifting the paradigm. Instead of using chemicals, we don't. So we save money by eliminating the use of these very expensive chemicals, and we build a smart substrate in that petri dish. So we grow the cells on a smart substrate, and that's our secret ingredient that's protected by our patent. And we literally pull the substrate from underneath the cells when they are grown, but we don't pull it. We kind of melt it away. So the cells are really empowered to release naturally, not forcefully. I mean, it's really the difference of somebody putting a gun to your head and saying, give me the $5 you have in your pocket, or just saying nicely, I don't have money to buy my bus ticket, please give me $5. You would probably give him the $5. That's what we do. We really empower cells to release naturally, and we can get cells to detach from that substrate, make them available 100 times faster than anybody can do currently on the market. We get 360% increase in the yields of the cells. And additionally, we can detach individual cells. We can grow any sort of cell. We can grow stem cells. We can grow rare cancer cells. And really the biggest problem in the medical therapeutics discovery is availability of authentic cells, just like in the human body. I feel that with what we have at Cellvana, we can scale it fairly easily, and we can start providing this authentic cells to medical researchers. We don't require FDA approval, so we can actually get to market quite quickly. And that's why I'm on a mission right now to raise money. And I really feel very strongly that regardless if you understand anything of what I say or not, we can all, as individuals, make a difference in curing cancer, in helping save a human life, even if we don't know it, but maybe we all know somebody that may have lost somebody to a rare form of cancer who may want to join us on our mission. Maybe they know somebody that could loan us some money, so we can actually commercialize this technology this year. So we can all make a difference. And and it's just much more than that, because I really believe that when we are empowered as human beings, and that comes through our cells, we are conscious creators of our lives. And that's how we change the status quo. We are empowered. Our minds can work miracles, what people call miracles, but that can become our everyday reality. And it all starts with the cells in our body. If we have happy, healthy cells that are in our body, like with stem cell therapy, for example, there are many issues. I'm sure you have heard of them. You have heard that in the United States, you cannot do embryonic stem cell therapy because human embryos are actually grown to about 5 days, and those cells are being harvested and injected into patients. And they create this growth factors, and they have a lot of healing effects, just miraculous effects in patients. However, when you're using cells from another organism, you are dealing with a ticking time bomb for genetic disorders. So a therapy like that may work. However, in an older patient, it may extend their life by 10, 15 years. So they may not have the time frame to develop a genetic disorder. But what about the 27-year-old football player that has a busted knee and his team doesn't want him off the field for more than a month? They send him down somewhere in Latin America, let's say, where he can get embryonic stem cell therapy. It works just like that. He gets back on the field, he's fine. When he turns 50, he may develop some sort of genetic disorder that they don't know about, or who knows what else. So there is a risk in what, and the public is not well educated in the source of the cells. The source of the cells is very important. They're also using umbilical stem cells. They also use stem cells from people's love handles, from fat reserves. There are mesenchymal stem cells that come from bone marrow that they extract from kind of the kidney area in the iliac crest. So those cells, they are available, but at the moment they don't have any method of knowing how many of those cells are alive, how many are they healthy, and how effective they are. Plus there are no controls, and there are doctors doing this kind of therapy right now. It is my mission and my goal to be able to use our technology to grow a patient's very own stem cells outside their body to critical effective concentrations so that they can be implanted back into the patient in a personalized therapy that has been developed just for them. And this basically makes obsolete the religious argument of where's the source of the stem cell, the political argument. It really gets to influence even insurance policy, because an insurance company would probably be very likely to cover such a therapy if the cells are coming from the patient himself or herself.
So is this something that in a future world, not too distant future, that maybe like the collection would happen like at birth? Because there's this, cell memory.
Yeah.
At some point, like the cell has been infected with this memory.
Correct.
So I'm just assuming the earlier that you gather those pure cells, the more.
Correct. That's absolutely correct. However, I believe every human being has the right to live the best quality life. at any age. So for those of us, like even my age, my parents didn't save my umbilical cord. So if I develop some sort of disorder that may be cured by stem cell therapy, I want to be able to use my own cells. And I do have down the road with what we are doing at Cellvana, there is much more to it that has to do with consciousness. And we do have one additional secret ingredient that we are going to deploy in due time to basically ensure that the cells are conscious, that there is, because there is consciousness at the cellular level. It has been studied, it has been talked about, not very widely adopted, because in the pharmaceutical industry there is a push for therapeutics and for drugs, but I think there is a place for all of it to come together. And I really believe in developing partnerships to come up with solutions. And that's how I want to develop Cellvana. I really believe that we're all connected. We're more connected than we realize we are. And I think it's really important to think in terms of shifting the status quo from following rules and standards that have not gotten us very far in terms of where we could be as human beings.
So let's talk about that. Like, I'm sure in your industry, a lot of those rules and standards are like the standard way of doing things. Mm-hmm. What are some of the things that are standing in the way of innovation in your field?
Well, there are a number of things. I mean, for startup companies like mine, it's basically funding, availability of capital to get us through what, in business schools they call the valley of death. It's really hard. I started this company with my own money. I took every penny of my investment account and I put it in licensing this technology and then starting this company, because I saw the value of it. I saw the market gap and requirement for high volume of the cells, and I thought, wow, this is amazing. Anything in nature that works, it's simple, and this is very simple. So that's the number one issue for medical device, life sciences, biotech companies like mine. We may have great ideas, but it's really critical that we get the publicity, that we get the investors who see the value, who are going to be able to join us and connect us, because technologies like this do not grow or happen in a vacuum and all of a sudden miraculously they show up on the market in 10 years. They require a lot of technical development, a lot of expertise, and a lot of networking and partnering. So, people like you guys, like your organization, maybe people that that can, bring us to the people that have the money to invest. They have the contacts and the connection to make this technology valid and to take it to the market. I mean, some other barriers, once we get through this, it's basically going through the FDA approval process, because our ultimate goal is to get into personalized stem cell therapy. So getting FDA clearance, that's another challenge. And in terms of the number one challenge is a technology like this is going to help pharmaceutical companies develop therapeutics. However, pharmaceutical companies, I believe, may be threatened by stem cell therapies, because that means people are taking back their power and people are getting in charge of their own health through their minds. There is the mind-body connection, and any doctor will tell you that the outcome of a patient that undergoes some major surgery who has a positive outlook on the outcome, on their life, has a much higher chance of healing faster than somebody with a negative outlook. So there is definitely the mind-body connection. It doesn't mean that if we don't see something, it's not there. And that's part also of my mission, because I really, really believe that at the cellular level, there is cellular memorization. The reason we get diseases is emotional, through emotions. If we get to control those emotions, if we're patients that are in the dire straits and they have advanced heart disease or maybe require an organ transplant, we can provide them cells that are their own cells that are conscious. In the meanwhile, they also undergo this process of becoming, of really taking back their power. And when you couple that with cells that are clear, they're just like in their body, they're conscious, and the cellular memorization has been reprogrammed to basically benefit their life and their health. I don't think the sky's the limit. I really don't believe there are any limits, and I really believe this would create a society that it's really it would benefit humanity all over the world. I really feel that what we do, it's a global technology. It's for well-being around the world.
So I think we would agree, and a lot of people would agree, that stress and is root cause, and the emotional state of a person over many years is a root cause of some of these diseases. So are you saying that in addition to just like harvesting the cells, that you're also like injecting some sort of like positive consciousness into the cells, so that they, once they're put back into the person, like they can kind of overtake the negative cells in a way, or just like change their mind? I
don't really believe in negative and positive. I think that's a construct of physics that may not necessarily be correct, but I really believe that one of my secret ingredients that I'm not going to mention exactly what it is. It has to do with clearing the consciousness of those cells, and that is at another level, but it really starts with us, because I really believe that people can actually cure themselves without necessarily requiring medicine and drugs. And the way I look at drugs, I'm a chemical engineer by training. I have a PhD in chemical and biomedical engineering, and I know chemicals, and I know you can take a drug that can supposedly do good and modify the chemistry of some disease, but you're only masking the reason why that disease occurred. And this generally, disease starts at the cellular level, and it has to do with cellular memorization. Once we can clear that cellular memorization, people can heal instantly. And it may not be, instantly, but it could be quite quickly. And there are scientists, there are doctors that have been studied that. Unfortunately, in the mainstream, media, you don't really hear about this discoveries and studies, because really they're threatening $1 trillion pharmaceutical industry, and that's not very sexy.
Well, it's fascinating, because I think our entire body is remade like approximately every 7 years. Is that correct?
Yeah.
Yet, like, we look the same and have the same conditions, and that it has to come from a memory of sorts.
Yeah,
that's the only thing that's left, right?
It is. It's the memory of things. It's genetic. However, genetics do not dictate a disease activation. They do not. What activates that disease, it's the environment. Cells are very sensitive to their environment. So if somebody grows up with the belief that Uncle John died of some named disease and he looks like Uncle John, well, guess what? That kid is going to develop sooner or later. They'll probably develop some named disease because they were told since they were 5 years old that they look like Uncle John. So they start believing that. So the question is, what do we believe? And my answer is, don't believe anything anybody tells you. Discover it for yourself, because that's what really creates a consciousness that's really in sync with our souls and with who we are, because it's much more than that. I believe the medicine, it's really on the verge of going through a shift. And to me, it's really sad that a lot of the innovators are looking to invent a better mousetrap, because that seems to be how things have been progressing. But who says that there cannot be evolution with another Big Bang, of which we are part? Who says that? Somebody? Because people create rules. The question is, the people who creates the rules, why can't we decide how we're going to live our lives, that we are healthy? We can choose in any moment that, and really that's reflected at a cellular level. Like I said in the beginning, we're made up of trillions of cells that are conglomerated into different organs and tissues, and and there's so much more than that connects all of us. So,
So where can someone find out more about you? How can they connect with you? How can they find out more about what you're doing in Cellvana?
Sure. Anybody who's listening, I'm happy to share my email. It's Ruta, R-U-T-A, at Cellvana, CELLVANA.com. Ruta@Cellvana.com, or just go to www.cellvana.com and you'll find the phone number and email. We are very transparent, and really we're looking to meet as many people who can help us take this technology global and really help save millions of lives.
Alina, pleasure. It's been a fascinating conversation, and I've enjoyed it.
Thank you very much. I really appreciate it, Tyler. Thank you. Thank you, Michael.
For more episodes, visit innovationcity.co and be sure to subscribe, rate, and review. If you're in Miami, visit us at Venture Cafe on Thursday nights. You can find details at venturecafemiami.org and connect with us on social at WeAreSlam and Venture Cafe MIA.
This is where it all begins, so say